Hello, it's Dr. Brandt Gibson, and yesterday we talked about the small fiber nerves. So today we're going to talk about the large fiber nerves. So before we do that, let me give you a little bit of reminder about how this works from a couple days ago. There are three types of nerve fibers: Group A, Group B, and Group C. Group A nerve fibers are the larger nerve fibers, primarily, although the Group A's are the ones that are broken down into the alpha, beta, and gamma nerve fibers. And as you remember, the gamma nerve fibers are the smallest, beta are smaller than the alpha, and you're moving down the line. And then the B fibers are in between the A fibers and the C fibers. The C fibers are the smallest unmyelinated fibers, and they are just small fiber nerves, just like the A delta fibers are also the small fiber nerves, as we talked about yesterday. The B fibers are primarily the autonomic nerves. So autonomic nerves, you can have some small fiber nerves that are autonomic nerves, but you also have the B fibers, which are the main portion of the autonomic nerves. So we won't talk more about the B fibers right now. We'll talk more about them in a couple days. So with that understanding, the large fiber nerves can be either sensory, for the large sensory fiber nerves, or motor nerves. And we will talk about the motor nerves tomorrow. So in the large fiber nerves, you have the 1A, A alpha nerves, which are the largest nerves, and they're responsible for proprioception. You have the 1B, A alpha nerves, which are the just smaller, and they're the Golgi tendon organ nerves and control some of that type. You have the 2A beta nerves, which are just smaller, and they are the cutaneous mechanoreceptors and some of the pain sensation. And then you have the small fiber nerves, which are the 3 and 4, or the 3A gamma and the 4C fibers. So large fiber nerves are those primary nerves. And so what's happening is with the large fiber neuropathy, you're actually having damage or malfunction of the A alpha nerves or the A beta nerves, which are the 1A, 1B, and 2 fiber nerves. So that being said, you're going to have some malfunction and have them so they're not working like they're supposed to. As opposed to the small fiber nerves where you get cell death, typically we're not seeing damage high enough where we're actually losing these nerve fibers. These are tested by multiple different tests. They can be tested by the nerve velocity testing. They can be tested by the EMG, including the pin type EMG functioning. And because of that, you can actually determine whether these nerve fibers are working or not. And you can also see if the damage is actually in the large fiber nerve or if it's in the spinal cord or higher. So with the peripheral nerves, you have the large fiber nerves, again, which is the A alpha and the A beta nerves. A alpha is broken into the 1A and 1B, and the A beta nerves are actually type 2. So all of those are myelinated nerves. If you have damage to the myelin sheath, then you're going to get slowing down of the nerves. You're going to get a weaker signal. And if you have damage to the axon or the dendrites of the nerves, you will have an incorrect signal or inability to present the signal. And if you have any damage to the nerve cell itself, the cell body, then you're going to have usually a weak or erroneous type signal. So this is large fiber neuropathy. It is a common type of neuropathy that needs to be tested, needs to be evaluated. It is usually the only one that's tested by a lot of neurologists and a lot of doctors when they talk about peripheral neuropathy, because they do the nerve testing and they don't do the epidermal nerve fiber density biopsies. This is Dr. Brandt Gibson, and this is Neuropathy Nugget Day 126, the large nerve fibers.